Hi, my name is Monica Bardwell, and I'm a student at the University of South Florida, and today I'm going to be doing a physical exam. Alicia, is it okay if I do a head-to-toe assessment on you?
Yes.
Alright, and before Alicia entered the examination room, her height and weight and her vital signs were obtained, and her distance vision was assessed via the Snellen chart. We're going to begin this assessment by looking at Alicia's overall general appearance, just watching her walk in, making sure she didn't have any physical deformities, just looking and seeing if she's dressed appropriately for this examination, and looking at her mood, if she's pleasant, which she is. I'm going to be looking at your skin and just looking for the texture and palpating, feeling for the temperature, which she's normal. Maybe looking at her nails and her fingers, making sure there's no cyanosis and her capillary refill is immediate. And I'm going to be doing this all the way down both legs and both arms, looking for any edema and just making sure that her skin is nice and warm and her capillary refills are nice in her toes as well. Next, I'm just going to look at her overall head and her face. I'm going to be just looking at her symmetry, making sure that her eyes are even with her ears and her hair is evenly distributed. I'm going to be palpating her scalp and making sure that there's no lesions or masses. All right, Alicia. And I don't feel anything, and it's good just to look behind because sometimes there can be lesions back there that can get easily missed. All right. Alicia, I'm just going to get you to do a few facial movements for me, and I'm going to test your cranial nerve number 5, which is the trigeminal. So I'm going to get you to just do a big smile for me and a frown. And open your eyes really big and close them really tight. Good. And that was actually cranial nerve number 7. And number 5 is going to be your motor and sensor. And I want you to open your mouth and close it. Good. And I'm just assessing her T and J joint, just listening for any clicks, making sure that it's freely movable. And also on cranial nerve number 5, it's a sensation cranial nerve. So I would have a cotton swab. Sorry. And I just want you to close your eyes, and I want you to tell me where my cotton ball is swiping across.
Forehead, cheek, chin.
Good. All right, and that is our number 5, our cranial. And then I'm going to move my assessment and palpate your temporals and your masseter. All right, and I'm going to palpate your sinuses, your frontal sinuses, and I want you to tell me if there's any pain or tenderness.
No.
And her maxillary sinuses. Okay, good. Next, I'm going to look at her eyelids and her eyelashes and make sure that they're still symmetrical and even the hair is evenly distributed. I'm going to look at her sclera and her conjunctiva, making sure there's no redness or drainage in both eyes. All right. And also on the eyes, I'm going to check for cranial nerve number 2, which is the optic nerve. And we're going to do this by doing what's called a confrontation test. Alicia, I want you to tell me whenever you can see my fingers come into your peripheral vision.
Okay. Now. Now. Now.
Good. All right. So via the Snellen chart and the confrontation test, she has an intact cranial nerve number 2. And number 3 is the ocular motor. And we're just going to be looking at the pupils and checking the shape and size and making sure that she is round and reactive to light and that her eyes are nice to accommodation. Just follow my fingers. Good, and you're just going to watch for pupil constriction. Next, I'm going to take my pen light and I want you to just look straight, focus your eyes on one spot on the wall, and I'm going to make sure that her eyes are constricting to the light. Good, and now I'm going to check for consensual constriction, which is whenever I shine it on her right eye, her left eye constricts. And when I shine it on her left eye, her right eye is constricting, which is consensual constriction. And that would be our ocular motor number 3. Next, we're going to check your 6 cardinal movements of gaze in your eyes, which is the extraocular movements. So I want you to just follow my fingers again. To the medial, upward, downward, back to the middle, up and down. And upward would be the trochlear nerve, which is number 4. And number 6 would be the abducens, which would be the lateral aspects of her extraocular movements. We would also take an ophthalmoscope and look at the internal structures of her eye, looking at the optic nerve and the optic disc. But we'll do that for another exam. Next, we're going to just look at your ears, noting the symmetry. If it's midline, even with the eyes, the top of the earlids should be just even with the eyes. And I'm just going to be looking for any drainage. I'm going to palpate the auricle. Alicia, I want you to take your finger and put it up to your tragus and tap really fast. And I want you to repeat a word that I'm going to say. Apple. Good. And that's what's called the whisper test, and that would be assessing cranial nerve number 8, which is the acoustic nerve, which is intact. All right, and next we're going to go to the nose. We would also, on our ears, assess with the otoscope. We would assess the tympanic membrane, making sure that it's white and pearly. We don't want to see any redness or inflammation or any drainage. And cranial nerve number 1 would be assessed by the nose by doing olfactory. You can take your finger and put it over one side of your nostril, blow out. All right, and do it to the other. Good, and we're just checking for patency. And the olfactory nerve is not really done in the clinical setting, but we could take a cinnamon or lavender or some kind of smell and just assess your smell and make sure that your smell is intact. Next, I'm just going to look at your mouth, looking at the color, making sure there's no cyanosis, and I'm going to palpate inside your buccal mucosa. All right. Just going to be making sure that there's no inflammation, making sure there's no lesions, just looking for the cleanliness. Good, and lift your tongue up for me. Good, and there's no lesions, because sometimes lesions can hide under the tongue. And now stick your tongue out for me, and to the right, and to the left. Good, and her uvula is midline. This would also be a sign of an intact cranial nerve number 12, which is the hypoglossal. And also we can assess cranial nerve number 9 and 10 with her mouth open, and this would be done with a gag reflex. I would have a tongue depressor, and I would put it on her tongue, and I would touch the uvula, seeing if she had a gag. So cranial nerve number 9 and 10 would be intact, which is the glossopharyngeal and the vagus. The vagus nerve also does the diaphragm, so we would just be making sure that her diaphragm is moving up and down evenly. Okay, next we're going to look at Alicia's neck, making sure that there's no lesions, making sure that her neck is midline even, and I don't see any twisting of the neck. And I'm just going to palpate. I'm going to palpate your lymph nodes and check your pre-auricle, your post-auricle, your occipital. I want you to tell me if there's any pain or tenderness.
No.
Jugulo-digastric. Look down for me. Submandibular and submental. The superficial cervical, and just turn slightly to the right. We would assess the deep cervical chain, which is best done with our head turned slightly diagonal. All right, look back straight. And we're going to do the superficial, this supramandibular clavicular. All right, and I don't feel any hard nodules or any freely movable nodes. Next, I'm going to look for jugular JVD, which is her jugular venous distension. If I can get you to take a look to the right corner, the left corner of the room. And we're just looking, making sure there's no distension and any pulsations. And we want to note that there's not any heaves or thrills on the carotid artery. And this is actually best assessed when the patient is supine and in a 30-degree elevation. I'm just going to palpate for any thrills or heaves. We want to make sure whenever we're assessing our carotid artery that we're not doing them at the same time, because it could occlude blood flow up to the brain. Okay. look straight for me. Good. And a brew would just be a turbulent sound of the blood flow. Next, we're going to be looking at her trachea, making sure that it is midline. I'm going to palpate her trachea. And then I'm going to attempt to palpate the thyroid gland, which is behind the trachea. I'm going to move it slightly to the right and to the left. And I can't palpate any thyroid gland, which is a normal finding. I'm going to move my assessment now to the lungs. We're just going to be looking at her respirations, making sure that her depth, her rate, and just her effort, making sure there's no accessory use of any other muscles, and she appears to be in no respiratory distress and no short of breath. All right, next I'm just going to, actually, Alicia, do you mind taking your shirt off for this? Good. All right, I'm just going to palpate. Good. All right, I'm going to percuss both sides. And a normal sound over the lungs would be a resonant sound. If we hear any dullness, that would indicate that we're over a rib cage, like bony prominences. Next, we're gonna look at the carina, which is in the fourth intercostal space on the right side, which would be right about here. And we're gonna note that the right lobe, the carina, and the apices of the lungs start about right underneath the clavicula, both underneath the clavicles. And I'm going to do that. That was the anterior portion of the lung exam. Now I'm going to ask you to turn over and we'll do the posterior side. And while you're this way, I'm just going to auscultate for any adventitious sounds on the front too. Good. Deep breath. Couple more. All right. Good. All right. And now we're going to do the same thing on her back. We're just going to be looking at the overall configuration of the chest, looking at the anterior posterior diameter, making sure that it's not the ratio is not bigger. We want to note about a 1-to-1 ratio. Anything bigger might indicate a COPD. Alicia, I'm just going to palpate back here. I'm just going to be noting any masses. Tell me if there's any tenderness. No. All right, next I'm going to say for tactile fremitus, I want you to get you just to say 99 each time I move my hands.
99, 99, 99, 99, 99.
Good.
99.
And we're just listening for any vibrations in our hands. We're going to test the diaphragmatic excursion and get you to take a deep breath. And out, and one more time. Good, and our thumb should come out about 5 centimeters, which is about normal for the diaphragmatic excursion. We could also percuss, and we want to note that anytime we don't hear resonance anymore, and the minute we hear dullness, we want to note that, and there should be about a 5 centimeter difference whenever we're measuring the percussion on the back. We want to hear a nice resonant sound. Good. And then I'm just going to auscultate for any adventitious lung sounds. Take a deep breath. Good. All right, we're going to do the same thing all the way down the back side of her lungs. And then we're going to listen on her lateral aspects of her lungs as well. Good. Deep breath. Very good. All right, if you can turn back to the front. Remember we're assessing between the lungs. We could also take note of her fingernails and make sure that she doesn't have any clubbing, which could indicate cyanosis. You can put your shirt back on. Next, we're going to do the cardiac assessment, and we're just going to be looking for the PMI. We're going to make sure that it's at the 5th intercostal space and we can feel it nice and strong. Good, and if we felt it anywhere else, like about the xiphoid process or the epigastric area, we might indicate that the patient has left ventricular hypertrophy. I'm going to palpate your pulses. I'm going to check your brachial, which is right deep in the humerus, and your radial, which is the thumb side of your hand, your ulnar, and we would do this to both sides. And while we're assessing the cardiac system, we also want to note any edema, and this is the dorsalis pedis and the posterior tibialis, and they're nice and strong and regular. Okay, you can put your foot down. All right, and whenever we're doing our cardiac assessment, we want to listen with the bell of our stethoscope as well as the diaphragm. Just sit right here. We would also do this with Alicia in a laying down position on her left side. And we would do the same thing with the bell of the stethoscope as well as the diaphragm. And your lungs sounded okay. Next, we're going to move to your abdominal assessment. Actually, I'm going to get you to take your, we'll just lift your shirt up. All right. And on Alicia's abdominal assessment, we're just going to be looking at the overall shape and contour of her abdomen. It's nice and flat, and it's round. Oh man, I got auscultate. Whenever we're doing an abdominal assessment, we want to make sure that we're auscultating first, that we don't want to disturb any bowel sounds. So I'm going to listen in all 4 quadrants. Whenever we're listening to that, we also want to listen to the iliac arteries and the renal arteries. And we want to make sure that there's no bruits. And we would also palpate Alicia's femoral arteries on both sides of her legs. Next, I'm going to do a light palpation on her stomach. And I'm going to be just feeling for any muscle tenderness, any organ enlargement, and I'm going to go to a deeper palpation. And whenever we're assessing the liver, we do what's called a hook liver. I'm going to get Alicia to take a deep breath, and we're kind of going to hook around her ribs, and we're going to do a deeper palpation to feel for her liver. Okay, thank you, Alicia. You can let out your ear. All right. And while you're laying down, I'm going to go ahead and do a musculoskeletal assessment on your hips. So if you can get you to stick your right foot straight out and lift it up and down, and put your heel up on the table, and take your knee and pull it towards your other knee and out to the side, and put your leg back straight and move it out laterally and back in. And we're going to do that same thing but against resistance. Lift it up. Good. And now down. Good. And now bring your knee up. Good. And now push out. Good. I want you to bring your knee in and out. And the same with the lateral. And that's testing flexion, extension, and abduction, adduction, and the subluxation. And we would do the same with the other. All right, and you can bring on around and swing it back around here. All right, and another part of the musculoskeletal, we're just going to go look at the head, and I want you to take your head and laterally bring it to the right and to the left. Good, and this is best, this says facing the patient right on. And I want you to take your chin and touch it to your chest. Now up and back straight. And now I want you to look to your right, look to your left. All right, and same, do it against resistant. Do a bending, and touch your chin, and lift it up. And back straight, and look to your right, and look to your left. Good. All right, next I want you to do a shoulder shrug. I want you to just, good, and now against my hands. Good, and that is also assessing cranial nerve number 12, which is the spinal accessory. Also on your shoulders, I'm going to do abduction and adduction. Take your hands and move it above your head like a gypsy. And now behind your back. And now straight out to the side. And now straight down. And I want you to stick your hands out like in a supine position. And in a pronation. And the same thing against my resistance. Bring your hands above your head. Good, and now behind your back. Good, and now lift them straight out to your side. And straight down. And now to the front, lift up, and now lift down. Good. And that's testing abduction, adduction, flexion, extension, and the rotation of the shoulder, the ball and socket. Next, we're going to, we did your hips. I'm going to do your wrist and your fingers. So take your wrist and lift them up, lift them down, to the side, other side, and now against my resistance. Down, to the side, and the other side. Good, and that's flexion, extension, abduction, adduction. Now your thumbs, bring them down to the top. Same with your fingers, squeeze them in, squeeze them out. Now against my resistance, do your thumbs, do them again, and now your fingers, and now squeeze up against my hand. Good. All right, now I want you to take your fingers and put them up high, bring them down low, again, and again. Good, and that's testing a flexion, extension, abduction, adduction of the fingers, and flexion, extension of the wrist, internal and external, and that was the subluxation of the thumbs. Next, we're going to do your knees. I want you to take your knee and extend it straight out, and back down, and against my hand, and back down. Good. And we would do the same with the other. I want you to take your feet and lift them up, push them down, and now against my resistance, and now push on the gas. Good. Now I want to do your ankle. I want you to move your ankle inward. This is inversion, out, exversion, and now against my resistance. Good. And now take your foot, and that was plantar, and dorsiflexion and plantar flexion. All right, and now I'm going to assess your spinal curvature. If I can get you to just stand up. And if you can just face forward. And I want you to take your hands and try to touch your feet with that. Going to be just looking at your spinal curvature, making sure that there's no kyphosis or scoliosis. And straight back up. All right, and I want you to bend to the right, bend to the left. Good, and now twist to the right, twist to the left. Good. And now bend against my resistance to the front, and now to the back, and now to the side, and now the other side. And now bend to the right, and now bend to the left. Very good. All right. And while you're standing, I'm going to go ahead and get you to do a gait test. Just take a couple steps forward, and a couple of steps back. And now I want you to do a tandem walking, and that would be a heel toe. Just proceed towards the door, doing a heel toe. And the same thing with that. And we're just noticing her gait and her balance, making sure that her movements are nice and smooth. All right, Alicia, while you're standing, we're going to do what's called a Romberg test. You can just take your hands, extend them out just like this. And I want you to close your eyes. And I want you to stand like that for about 20 seconds. And I just want to make sure that her balance is okay. And she's not having one arm drift down, one arm drift up. Okay. Now we have about 20 seconds. And next we're going to do the pronator drift. I'm going to try to push resistance against your hands, and I want you to try to put them back in place. Good. Okay, Alicia, you can have a seat back up on the table. Okay. Also a part of the neurologic exam, we're going to do what's called the memory test. I want you to repeat 3 words I'm going to say to you. Facebook, Apple, baseball.
Facebook, Apple, baseball.
Good. So she passed the memory test. Another part of the neurological test is going to be, I want you to be touching your nose with your fingers. If you can just extend your fingers way out, point them. And now take your right finger, touch your nose, and your left finger, touch your nose, and do it quickly. Good. All right. And next we're going to do, you can put your hands down. We're going to do a rapid lap slapping. So if you can just take your hands, up and then back and forth, nice and fast, like you're playing pancake. Very good. And we're just noting any smoothness, making sure that her movement is nice and smooth and she doesn't have any involuntarily muscle spasms. Next, I'm going to do sensation. And I want you to just tell me if it's the soft side of this Q-tip or the hard side of this Q-tip whenever I'm rubbing it on your hand, okay? Close your eyes.
Soft, hard, soft, hard, soft, hard.
Good. All right, and so she would pass the sensation part of the neurological exam. Alicia, well, that concludes our assessment for today. Do you have any questions for me?
No.
Okay, well, thank you so much.
Thank you.